Okay, so loop diuretics, these drugs they have major action on the ascending limb of loop of Henle, and of all the diuretics, these drugs have the highest efficacy in mobilizing the sodium and chloride from the body. Okay, so it produces copious amounts of urine. Copious means very huge amounts of urine are produced by these particular diuretics when they are given. Okay, so similar to the thiazides, these loop diuretics they do not generally cause the hypersensitivity reaction in patients with allergies to sulfonamides antimicrobials such as sulfamethoxazole because of structural differences in their sulfonamide derivative. Okay, so it is known that the thiazide diuretics they can cause the allergic reactions, but the loop diuretics they do not produce any such type of reactions. Okay, so the main or the foremost loop diuretic that is used clinically, it is furosemide or frusemide. Either way, we can call it. Okay, so the use of bumetanide and the torsemide, which are the other loop diuretics, it is increasing day by day as these drugs they have better bioavailability and they are more potent when we compare it to that of furosemide. Okay, so ithacrenic acid, the another one loop diuretic, is used infrequently due to its adverse effect profile. So next is mechanism of action of these drugs. Just wait a second, I will take the pen. Okay, so mechanism of action simple. It inhibits the co-transport of sodium, potassium and 2 chloride in the luminal membrane in the ascending limb of the loop of Henle. Okay, so understand one thing very clearly, what these diuretics do. Okay, diuretics, all of these diuretics they have like a sole purpose and to produce the diuresis is that they inhibit any transporter that transports the sodium from the lumen, that is from the filtrate to the interstitium. Okay, so this particularly in case of loop diuretics they block the action or they block the transporter, that is sodium, potassium and 2 chloride, and it is a co-transporter. That means all of these ions, the sodium, potassium and the 2 chloride ions, they are traveling in the same direction, that is from the inside of the tubule to the outside of the tubule. Okay, so these drugs loop diuretics they block this particular transporter and thereby they keep the sodium in the lumen itself. And you should remember this in relation to that of diuretics, that wherever sodium goes the water follows. So if sodium is staying inside the tubule, the water will also stay inside the tubule, and therefore there will be increased in excretion of water. Okay, and we call it as diuresis. Okay, so therefore reabsorption of these ions into the renal medulla is decreased. Okay, so by lowering the osmotic pressure in the medulla, less water is reabsorbed from the water permeable segments like the descending loop of Henle, and thus it causes diuresis. These agents they have the greatest diuretic effect of all the diuretics because the ascending limb it accounts for reabsorption of 25 to 30% of filtered sodium chloride, and downstream sites are unable to compensate for the increased sodium load. Okay, so that's why these particular diuretics they are the most efficient diuretics of all the diuretics which we have studied till now. Okay, so the actions of these particular loop diuretics, so the first one is the diuresis. Okay, so these drugs they cause diuresis even in patients with poor renal function or lack of response to the other diuretics. So the loop diuretics, they display a sigmoidal dose response curve, as you can see on the right side, with three parts. That is a threshold effect, then there is a rapid increase in diuresis, and with small changes in a drug concentration and a ceiling effect. Okay, so what is this threshold effect? Threshold effect means what? A dose when we give of the loop diuretics, it should reach a certain concentration in the in that particular site of action, so that it can produce the diuretic effect. Okay, so if the dose remains below this particular level, then there will be no diuretic action. Okay, but once the dose or the concentration at that particular site of action, if it reaches to this value, a small increase in the concentration over there, it will cause rapid increase in the diuresis. Okay, so this rapid increase you can see in the diagram itself. Rapidly the diuretic response is increasing with small increase in the concentration of the diuretic. Okay, so once this concentration reaches to this particular level, at this top level, one second, why my pen is not working, one second. Okay, so now it is right. Okay, so once this particular concentration reaches to this level, this response reaches to this level, there is ceiling effect. That means if you increase the diuretic concentration in loop of Henle beyond this level also, you there won't be any increase in the diuretic response. Okay, so that means we got a ceiling effect over here. Okay, so next is there is increased urinary calcium excretion because of the loop diuretic. So unlike thiazides, the loop diuretics, they increase the calcium content of the urine. Okay, so in patients with normal serum calcium concentration, the hypocalcemia does not result. Okay, so why? Because the calcium is reabsorbed in the distal convoluted tubule in such persons. Okay, so next action we get is the venodilation. So prior to the diuretic action, these loop diuretics, they cause acute venodilation, and they reduce left ventricular filling pressure via enhanced prostaglandin synthesis. Okay, so next is therapeutic uses. So it is used in treatment of edema. So what is edema? Edema is excessive accumulation of fluid inside the body. So when we give the loop diuretics, it causes loss or loss in the body weight. That is because of the accumulation of the excess of the fluid in the body. Okay, then next is hypercalcemia. As we have seen, it causes excretion of the extra calcium. Okay, in case of normal person with normal calcium levels, there is no effect, it is not causing hypocalcemia. But in case of hypercalcemia, it causes excess of calcium to be excreted through the urine. Then hyperkalemia, as it acts on that particular sodium potassium 2 chloride channel, it also, along with sodium, it also causes excretion of the potassium through the urine. Okay, so next is pharmacokinetics. These drugs, they are administered orally or they are administered parenterally. The furosemide, it has an unpredictable bioavailability of 10% to the 90% after oral administration. That means we cannot exactly judge that how much concentration of the furosemide will be available in the plasma after it is administered orally. Okay, then we have the bumetanide and the torsemide, the other loop diuretics. They have reliable bioavailability. That means we certainly know that they will be bioavailable between the concentration that is 80% to the 20%. Okay, so it makes these agents preferred for the oral therapy. So the duration of action is approximately 6 hours for the furosemide, bumetanide, and moderately it is longer for the torsemide, and thus allowing patient to predict the window of diuresis. Okay, so next is adverse effects which are associated with the these loop diuretics include the first is the acute hypovolemia. So in this case the loop diuretics can cause severe and rapid reduction in the blood volume with possibility of hypotension. That's because the action its action is very efficacious, so it causes like frequent urination. That's why there is decrease in the blood volume and there is probability of the hypotension. Then also it can lead to the shock and the cardiac arrhythmias. Then hypokalemia, as it causes excretion of the potassium, it can lead to the hypokalemia. So the heavy load of the sodium presented to the collecting tubule, it results in increased exchange of the tubular sodium for the potassium. Okay, so here when as the sodium is kept into the lumen, the excess of sodium which is remain in lumen is exchanged for the potassium in the collecting duct. So more of the potassium it comes inside the lumen. That's why excess of potassium is lost through the urine, and thus it leads to the condition called as hypokalemia. So the most common adverse effect of the diuretics, these loop diuretics, is this, that is the hypokalemia. So the loss of potassium from the cells in exchange for hydrogen, it leads to hypokalemic alkalosis. So use of potassium sparing diuretics or supplementation with the potassium, it can prevent development of hypokalemia. So when we are giving the loop diuretics to the patient, it is usually suggested that patient should take the potassium supplementation like eating the bananas which are rich source of the potassium, or either ways they can opt for the potassium sparing diuretics which we will be studying in detail in next few slides. Okay, the next adverse effect is the hypomagnesemia. So urinary loss of magnesium, it can lead to the hypomagnesemia. Okay, so next adverse effect is the ototoxicity. So reversible or permanent hearing loss, it may occur with loop diuretics, particularly when it is infused intravenously at very fast rates at high doses, or when used in conjunction with other ototoxic drugs, examples of which that is the aminoglycoside antibiotics. So with current dosing and appropriate infusion rates, ototoxicity is a rare occurrence with that of the loop diuretics. So ethacrenic acid is most likely to cause ototoxicity. That's why it is rarely used. So although less common, vestibular function may also be affected, inducing vertigo. So what is the relation between the ototoxicity and the diuretics is that if you remember the anatomy and physiology of the ear, the ear, this vestibular apparatus and cochlea and all, they inside of them there is a type of fluid present, that is the endolymph and the perilymph. Okay, so what these fluid are, what is the base of it, it is all water. Okay, so composition wise it will differ from the other fluids, but what is the main basis of these fluids, it is water. So these diuretics they cause loss of water, and as they cause loss of water, it will lead to the ototoxicity. Okay, then next is hyperuricemia. So the loop diuretics they compete with uric acid for the renal secretory systems, and thus blocking its secretion, and in turn it may cause or exacerbate gouty attacks. So gout is a disease into which we have seen that there is excess of uric acid deposition in the body, and this uric acid deposition causes gouty arthritis. Okay, so next category of drugs, that is thiazide diuretics, but these drugs we will study in next lecture. Okay, so I should stop over here, it's time for the next lecture. Okay, thank you.